Hello, I'm Dr. Rachel Wooten, and I'm the coordinator of the undergraduate nursing programs here at JSU's School of Health Professions and Wellness. I'm so excited to tell you about our nursing program. But first, let me give you a little bit of history. Prior to the 19th century in the United States, unwell individuals usually received care in the comfort of their own home or members of their family, or church members who had knowledge of remedies and healing practices. Then, at the beginning of the 19th century, hospitals began to appear among highly populated areas in order to serve individuals who didn't have the necessary resources to care for themselves or their families. Today, there are more than 10,000 public hospitals, 15,000 nursing homes, and not to mention numerous veteran care, military facilities, and independent practices and clinics in the United States. In the 19th century is when nursing education began to appear in the U.S. It was heavily influenced by the care and practice of Florence Nightingale. The College of Nursing at Jacksonville State University was created in 1967 by the legislature of Alabama. The first class graduated the college in August of 1972, and graduates of this program earned a Bachelor of Science in Nursing degree. The RN to BSN post-licensure STEP program was established in 1995. The addition of a master's degree program with a major in community health and nursing was approved in June of 1998, and the inaugural class was admitted in fall of 1999. Since 2015, the College of Nursing was absorbed into the School of Health Professions and Wellness and transitioned into a Department of Nursing. The Jacksonville State University School of Health Professions and Wellness was established to deliver a top-quality education for 21st century professionals in an effort to promote health and wellness in our communities, state, nation, and around the world. The Department of Nursing has developed undergraduate, graduate, and doctoral programs utilizing the latest evidence-based practices. It is our goal to prepare future leaders in health and wellness professions. Now, why JSU? Nursing is one of the most trusted professions in the United States. Here at JSU, we develop quality nurses prepared to engage with the global healthcare environment with emphasis on practice, service, and scholarship. When you graduate from JSU Nursing, you will be an exemplary nurse, empowered and prepared to care for anyone at any time, anywhere. Now, what does it take to get in? Sorry guys, there's criteria you gotta meet. First, you have to fill out an application. We do have criteria for early acceptance, and we do have criteria for acceptance into upper division. We do want you to complete for early acceptance the application, which is a School of Health Professions and Wellness application as an entering freshman. Here's the criteria for early acceptance. Completion of JSU's admission application and School of Health Professions and Wellness application as an entering freshman. Acceptance and enrollment to JSU directly from high school. Declare nursing undecided as your major. Your GPA of 3.5 or greater, your composite ACT score of 24 or greater, and an essay related to your choice of nursing as your career path and motivation for working in the healthcare field. We also request letter of recommendation from someone with healthcare experience that could speak to your abilities and potential for success in the healthcare environment. Okay, so here's the criteria for progression to upper division. Successful completion of required undergraduate core coursework here at JSU and a GPA of 3.4 or higher. Upper division nursing courses consist of 5 semesters. Our first semester, we have pharmacology, health assessment, and foundation of nursing practice. This is where you learn the foundations of nursing care and nursing theory. Second semester, we have med-surgical, we have health deviations, and we have psychiatric mental health nursing. In the summer, we have a nursing research class. Then in your third semester, we have childbearing families, which is your obstetrics course. We have nursing care of children and families, which is your pediatrics course. And we have also a foundations of nursing leadership. In your fourth semester, this is where we have advanced adult health, community health across the lifespan, and advanced clinical deviations and interventions. This is actually your critical care experience. And then in 5th semester, this is where you work one-on-one with a registered nurse in their healthcare environment. We also have a course, NU 302, which is your preparation for your NCLEX success. Your NCLEX is your national licensure exam that every nurse has to take to be able to practice. Clinical experiences for nursing includes our first semester. We use a lot of simulation. We actually visit into the nursing home. We visit into rehab. We actually even go into the hospitals. We practice that foundational nursing care and theories that we learn. In second semester, we have med-surgical and psychiatric clinical experiences. Some are inside the hospital and some are at outside facilities. In third semester, you have your OB and pediatric experiences. In fourth semester, you have critical care and community. This is where you will have experiences in the intensive care units, and you will be actually functioning with RNs out in the community as home health or at clinic nursing. In fifth semester, which is your practicum, this is where you actually work one-on-one with a practicing RN in their work and environment. We also use simulation in our learning. We have our Nursing Arts Lab at the JSU South Campus. We have a state-of-the-art SIM Center at JSU Brookstone. We have low fidelity and high fidelity simulators. We even have simulators that deliver babies. Simulation is a safe learning environment where mistakes can be made without harm to you or your patient. The goal is that you learn. You'll also be teaching out in the community. You'll be teaching in the hospitals. You'll be teaching to all ages and all types of people. In one of our environments, we actually go to Camp Seal Harris. This is where you even participate with the students. These are diabetic youth that have a 2 to 3 day adventure. You actually become family. We play dress up with our kids, pediatric patients. We even have our friendly nursing dog Kirby at some of our nursing events. And I'll tell you something, our nursing students really love Kirby. We also have student groups. We have JANS, which is Jacksonville Association of Nursing Students. We also have JSU Nursing Ambassadors. These students help participate in some of our nursing events. We want you to know that we celebrate your hard work. Sigma Theta Tau is one of the organizations that is nationally recognized for success in nursing. Also, I wanted you to think about what you're going to do when you're out in the workforce. Some of our students are in the workforce today. Taylor and Caleb are working the front lines. They're out on the COVID units, taking care of anything, anywhere, at any time. We want you to join our JSU nursing family. We hope you'll participate in our Accepted Students Day, where our future healthcare professionals meet and learn about our campus. We want you at JSU Nursing. Here's our contact information, and we look forward to hearing from you. Thanks.